This morning we had a meeting with the Department of Health officials and with the Epidemiological Bureau of the Department of Health, and we had a very extensive discussion on the epidemiologic investigation of the outbreak. And as a result of that, we can now confidently say that we are already out of the woods. The outbreak is over. So we're now shifting to an endemic level. We are now experiencing the usual occurrences of disease in our population in the city of Baguio. Meaning, ito na yung normal na mga diarrhea cases na nararamdaman natin. During that meeting this morning, we were also able to, one way or the other, let us say 80% determine the cause of the outbreak. And we have identified the one way or the other the cause and how it spread. Basically, the dynamics of how the outbreak spread, or how the diarrhea incidents spread that resulted into an outbreak. And this will be explained later on by our epidemiologists. Meantime, I would like to request Dr. Sel to give us more briefing on the outcome of that discussion this morning with the officials of the Department of Health.
Okay, Dr. Sel.
Yes, good afternoon. Okay, initially we were relying on our self-reporting system of diarrhea cases in the city of Baguio. And really, it seems that it is similar to what our Epidemiology Bureau team also has discovered among the cases of diarrhea. However, we would like really to explain that really we had an outbreak of diarrhea or acute gastroenteritis in the city of Baguio from December 2020 to January 13. But the cases that were under the case control study were the cases from December 26 to January 13, resulting from a waterborne source, which is water sources have been contaminated. We had human sample tested positive for norovirus and other viral etiologies. However, bacterial culture is still ongoing, and it cannot still be ruled out for bacterial pathogens. So since we have a past 2 incubation periods of our cases significantly going down, and that there are no cluster cases from the peak of our outbreak from January 7 to 8, and that we have already also identified water sources, then really the outbreak is over.
Tatagdagan ko lang, Gabi, we conducted a very extensive test of various sources of our water source, various sources of our water in the city of Baguio, both private and from the Baguio Water District. And we have subjected these specimens to both bacteriological tests and virology. So I can confidently say na lahat ng klaseng test na ginawa natin dun sa water na supplied by the water district, it is totally, and I would say completely and absolutely safe. So in short, you can now drink directly from the faucet. Ganon ka-potable yung water natin. Ganon kalinis yung water ng ating. So there's no contamination insofar as Baguio District water supply. As long as it doesn't go or it pass through an intermediate storage. Ibig sabihin, from the filtration system, diretso sa distribution line hanggang sa faucet, pwede niyong inumin ho yan. Malinis ho yan, basta Baguio Water District. Kaso ho, pag merong tangking dinadaanan, yan ho, kailangan ho talaga ng filtration yan. No? So yun po anong kalinis yung ating tubig ho dito sa siyudad ng Baguio.